Hello, my name is Jessica Hubbard, and I'll be giving a presentation and recommendations on the machine shop at the University of New England in fulfillment with JPH 724. Some background and demographics. The machine shop is located in Biddeford, Maine, and it's on the University of New England's campus. The hours of operation are from 6 a.m. to 3 p.m. There's 15 full-time employees. 90% of them are male, 10% female, ages 30 to 65. And the duties and hazards, the majority of the work is on the campus vehicle, and there's a lot of heavy lifting, repetitive motions, and exposure to hazardous material, with potential damage to eyes and ears. Some areas of concern and why this matters. So as you can see in the center, I have some back injuries, psychosocial, and safety. So those three areas. And then on the right, you can see that for back injury, there were 3 reported injuries in 5 years and 10 days lost of work. The MOD rate decreased from 1 to 0.75, which is actually really good. For psychosocial, one employee did report that he does have to work hard and fast and oftentimes does not have enough time to complete his tasks. So psychosocial factors, they actually increase the risk of workplace injury and are also linked to an increased tobacco and alcohol use. Psychosocial stressors, maybe not feeling like they have enough time to finish things, very rushed, but yet their supervisors want them to complete tasks without error. So there's a lot of pressure oftentimes in that predicament. Another issue is with lifting, gripping, and repetitive motions. The NIOSH lifting application is available for free. You can actually download it to your phones. And I would have you guys encourage your employees to download those apps to their phones or a computer that might be in the machine shop, and you can plug in the calculations and it will actually give you whether or not if something is safe to lift and the risk associated with it. So it matters because OSHA reports that employers pay out $1 billion a week for compensation to employees in the United States. And back injury rates are the highest in occupations that require manual labor such as lifting, bending, standing for long periods of time, etc., which is basically exactly what the machine shop employees are doing. And this type of environment of working fast and with dangerous elements and equipment can potentially lead to an unsafe work environment. And studies emphasize the importance of assessing both the physical and the mental health for optimal employee health and satisfaction. So recommendations I have for the first one, establishing a safety committee. That should be primary. That can actually help with aligning with best practice guidelines and safety training, staff training, accident investigations, and workplace self-inspections. It helps to kind of create this environment where everybody is caring about one another and the safety of their employees and their team, their counterparts. Because really nobody wants to work with somebody in a dangerous environment if they don't feel that their team member is practicing safely either. That could be very, very dangerous for everybody involved. So the second one is for culturally appropriate manuals, just making sure that we're assessing that the employees are having MSDS and safety manuals in their primary language if it is not English. And the JRQ questionnaire, my recommendation would be to have them fill out that questionnaire in private, definitely not a one-on-one type of questionnaire, because oftentimes employees might feel pressure to answer in a way that their supervisors might want them to answer. The other one is for the vibration hazard. The calculations for that Ingersoll Rand tool did say that it was considered a hazard, so I would either purchase a more compatible tool or limit the time of consecutive use. Recommendations for the respiratory, I would have the ventilator timer run from 5:30 a.m. to 3:30 p.m. just to clean out that area a little bit more. Make sure the masks are available. Use proper body mechanics for lifting precautions, gripping, take breaks from repetitive motions. For visual, I did not see an eye wash station, and so I would incorporate an eye wash station and supply PPE goggles. And for psychosocial, I would encourage the staff to be transparent in reporting their own well-being. And supervisors, they should be able to recognize the signs and symptoms of stress, depression, anxiety, and be able to talk to that employee, because it does come from a place of caring, and everybody wants to work in a safe environment. So thank you for your time and your conscientious effort to improve the health of your employee.